Let's talk about the American healthcare system. It's this giant, complicated maze, right? It affects every single one of us, but honestly, trying to make sense of it can feel like a full-time job. So today, we're going to pull back that curtain and try to unravel it piece by piece.
Okay, to really get what's going on, you got to start with just one number. And it's a pretty wild one, 18%. That's the chunk of our entire economy, every single thing we produce and sell, that goes straight into healthcare.
And here's where that number goes from just big to, well, kind of shocking. Just look at this. That huge bar, that's us, the US. Then you see the average for other developed countries, it's about half. And here's the real kicker. For all that extra money, we're not actually healthier. In fact, on things like life expectancy, we're often falling behind. So that's the big question, the paradox we're diving into today. Why are we paying so much more for average results?
All right, so here's our game plan. We've just hit on the paradox. Next, we'll get into how we ended up with what some historians call the accidental system. Then we're going to dig into the nitty-gritty of why it costs so much. And finally, we'll look at the two big ideas for how to fix it.
So you might think our system was, designed this way on purpose. But nope, not at all. It's really just a patchwork quilt of historical accidents, a series of reactions to different crises over the last 100 years or so.
In this timeline, it shows you exactly what I mean. It all kind of started back in 1929, right in the middle of the Great Depression. Hospitals were struggling, so one at Baylor University came up with this clever idea for teachers, a prepaid plan. That was basically the birth of Blue Cross. Then, jump ahead to World War II. The government froze wages, right? So companies trying to attract workers started offering health benefits instead. That was a huge deal. But the real game changer was in 1954, when the IRS made those benefits tax-free. Boom! That's what really cemented the whole employer-based model we have now. And of course, by 65, it was super clear that this system was leaving a ton of people behind. The elderly, the poor, which is why Medicare and Medicaid were created. See? Each step was a reaction, not a plan.
And all of this led to something called the Great Split. See, when the big commercial insurance companies jumped in, they changed the rules. They started using what's called experience rating. Basically, instead of everyone paying a similar price, they started charging you based on how risky you seemed. So if you were young and healthy, great, cheap insurance. But if you were older or had health problems, the price was astronomical, totally unaffordable. And that is the exact reason Medicare and Medicaid had to be created. There was no other choice.
Okay, so that's the history. That's how we got this unique patchwork system. But that still doesn't explain the price tag. So now let's talk about the money. Why is it so expensive?
At the very core of all this is one simple idea: fee for service. And it is exactly what it sounds like. Every time a doctor or a hospital does something for you, a test, a procedure, an office visit, they get to send a bill for that specific service.
And this, right here, is the fundamental flaw in the whole system. It creates a financial incentive to simply do more stuff. It rewards the volume of care, not the value of it. It doesn't matter if you actually get better. What matters is how many services were provided along the way. So naturally, the incentive is to order more tests, to do more procedures, because that's how you make money. It's a system built for volume, not for outcomes.
But it's not just fee-for-service. There are a bunch of other things driving up costs. For one, administrative waste is just off the charts. You've got thousands of different insurance plans, all with their own rules. Hospitals have to hire armies of people just to figure out the billing. Then there's the fact that prices are a total mystery. You almost never know what a procedure costs until you get the bill, which is crazy, right? And finally, you have this massive consolidation going on. Huge hospital systems are buying up smaller ones, which means less competition. And less competition, as we all know, means higher prices.
So pretty much everyone agrees that this is not sustainable. Something's got to give. The big disagreement, though, is on how to fix it. And the whole debate really comes down to two totally different ways of thinking about the problem.
All right, so path number one basically says, hey, the market isn't the problem, it's that our market is completely broken. The goal here is to fix it, to make it act like a real competitive market. So what does that look like? Well, you'd enforce antitrust laws to break up these giant hospital monopolies and actually create competition. You'd force hospitals to be transparent about their prices so you, the consumer, can actually shop around. And it would also mean reining in some of the more profit-driven practices and cutting through all that insurance red tape that denies care.
Then you've got path number two, which is a much bigger change, moving to some kind of universal single-payer system. Think Medicare for all. And there are some really compelling arguments on both sides here. The pro column is pretty powerful. Everybody's covered, no matter what.
You'd slash all that administrative waste from private insurers. The focus could shift to keeping people healthy in the first place, and the government would have massive power to negotiate lower drug prices. But the con column is just as serious. It would mean huge tax increases, no way around it. There's a real risk of longer wait times for some procedures, and some folks worry it could stifle the innovation we see in the private sector. And of course, just the sheer chaos of switching from one system to the other would be a massive undertaking. So, that's where we are. The US is at a fork in the road. Do we try to fix the market we have, to sand down its rough edges and force it to be more competitive? Or do we scrap it and build something completely new, something more like what the rest of the developed world has? A better market or a new system? That's the billion or maybe even trillion-dollar question for the future of healthcare in America.